I have the chat up if I need to receive any messages from anybody while we go through these slides. So the title of this presentation and the sort of the general idea of this project is the implementation of a taxi vanpool service to remove transportation barriers to work. This is an image of my colleague on the project, Bill Carter, who is the general manager of Union Cab. And Union Cab was our main partner here. This is the taxi, part of the taxi vanpool service. I'll start with sharing sort of the general problem definition that motivated our work together to create a taxi vanpool service. And in fact, it did start with the taxis. So we know from the literature that car ownership leads to positive employment outcomes for lower income workers. But we also know that car ownership is expensive and may not be the ideal solution for a broad-based policy for employment transportation or any other transportation for that matter, especially with income constraints. We also know that transit service, which is another recommended option, is not always adequate in low-density areas. And much of the job growth occurs in these low-density areas, and this limits the ability of workers as well as employers to match in a regional labor market. So that's sort of the general problem from from a policy or a research perspective. But the image on this slide shows sort of what this problem looks like from the perspective of a traveler. So if I want to go from the south side of Madison, the Walmart Supercenter, to the Walgreens Distribution Center, which is a major employment center up in the northern part of the region here in Madison, Wisconsin, there is no transit option. And this is the sort of the error message that one would see if they were to look this up in a Google map. Right, sorry, we can't calculate directions. So I'll take you through the outline of what I'll present in these slides. I'd like to begin just by sharing our main concept behind the taxi pilot program. This is even before we added the vanpools. Working with Union Cab, our initiative sought to provide rides to low-income workers. In the second part of the presentation, I'll share I'll focus on the challenges that we faced in our implementation of this program. The main challenges that we identified were achieving scale to create a system based on shared rides. We also found that our initiative had high administrative costs, and there was some amount of abuse that we dealt with, but didn't wholly appreciate at the beginning in our design phase. And finally, in the third part, I'll share lessons learned, mainly around ideas about service integration between these different modes to form sort of a complement to a local transit system. Talk about the potential for information technology to help address some of the challenges we faced, as well as the role of organizational or institutional changes. One idea is to implement transportation management associations to complement regional planning. Before I go any further, I'd like to acknowledge and salute my fantastic project team. Our main transportation service provider partners were Union Cab of Madison, it's a cooperative, UW Transit Job Ride Program, the Village of DeForest, the Madison Area Transportation Board, which is our regional metropolitan planning organization, the Madison Card, which is a technology startup, and the University of Wisconsin-Madison. So a bit about the background. This may be well known to our audience today, but so the general sort of literature that this work speaks with is on transportation disadvantage. And a basic working definition of transportation disadvantage is not having affordable transportation options to get to work or school or other kind of essential places. And we know that transportation disadvantage disproportionately affects older residents, people with disabilities, people with lower socioeconomic status, women, and people of color. And transportation disadvantage sort of has three main dimensions: these demographic factors, as well as urban form. And there's a service dimension to this, which is sort of the design and operation of different types of public transit. Now, in our local context, this sort of slide speaks to the need for affordable transportation to low-density suburban locations. These are the locations where job growth rates are the highest. Now, the central part of Madison indeed has the highest absolute number of jobs, and it is also growing, but the highest growth rates are in the suburbs. And this is the spatial mismatch problem is, contributes to the challenges of recruiting and retaining both labor as well as firms in the region, because there can be challenges to the ability to sort of implement the labor market and to get these jobs and workers to match. So this is the context in which we're operating. And we had a specific opportunity to which we responded. It was called the Commute to Careers Program. Now, this was a $5 million grant program for the state of Wisconsin. It ran from 2018 to 2020. It was supported and implemented, operated by the Department of Workforce Development and the Department of Transportation at the state level. Now, working with Union Cab of Madison, we submitted a proposal to this grant program, and we were awarded the grant to carry out our Union Cab's Commute to Careers program. Now, I should mention that Union Cab is a special organization in many levels, especially for the taxi cab industry. It's a traditional taxi cab company. They're regulated as a traditional taxi cab, but they are a very large taxi fleet. They have at least 60 vehicles, over 100, maybe approaching 200 employees. And though they're a private firm, it's a private cooperative, they have these civic values and sort of operate in the public interest like a public agency. They pay a living wage. They hire their taxi drivers and other employees as employees who get benefits. And their mission as a firm isn't only to provide transportation, it is to create and support job growth and living wages for workers. So on a sort of a values level, Union Cab has an interest in the spirit of a Commute to Careers program. Now, the specific program we designed, Union Cab's Commute to Careers, kind of had three principles. The first was that employers and workers, because they both benefit from this commute, would also share the cost of the commute. And we looked to employers to invest in such a program, and we looked to workers to pay a fare or some kind of a copay. And the goal of this was to operate shared rides and to create sort of sustainability in the operations, as well as financial operations, without grant support in the long run. And then the third sort of component of this program was to innovate Union Cab's business and operations to compete with transportation network companies in our local market. Now, Union Cab, being a large firm and well-run, has a lot of contract work that enables it to survive and even to compete with TNCs. In fact, they have a great reputation in our market, and many people will say, well, maybe not everybody, but many people will tell me that they are loyal customers of Union Cab. Union Cab has an app, and they tend toward being modern, but their fares are indeed higher than TNCs, and they have seen their share of the weekend and nighttime hailed ride market decrease over time. So we're thinking about, well, what would it take for a traditional taxi cab company to innovate and to compete? And we're also thinking about, well, what does it take for a traditional taxi cab company to enter what I'm calling here the transportation disadvantage market? In other words, this area of transportation service provision and a set of consumers that's sort of governed by a unique set of regulations, federal policies, funding mechanisms. What is our theory of change to improve or expand service for this market to keep it sustainable, affordable, and to create more options for providers as well as consumers. I'm thinking about some novel configurations, about how travel modes or services such as microtransit, volunteer drivers, the FTA's Rides to Wellness program, or TNCs might be involved in supporting travel in this market. Now, on the image on the right, the sort of figure shows how I kind of conceptualize these kind of traditional modes: transit, taxi, van, and limo, the private auto, and specialized transportation services, sort of in their own bubbles. But then each of these novel configurations, like Rides to Wellness, microtransit, volunteer drivers, and TNCs, are illustrating how these different modes are sort of blending together. So Rides to Wellness was a program that used transit, expanded transit to support non-emergency medical trips, sort of as a form of specialized transportation. Microtransit speaks to using taxis and integrating them into a transit system. The TNCs are an example of where private autos and private drivers are operating like a taxi, but in a market that's regulated slightly differently. And again, these private autos are often used by volunteer drivers to provide rides to older travelers, people with disabilities, and other kind of specialized markets. So we do see sort of interesting configurations arising. So my own sort of research interest in this is, what does it take to organize these fragmented sectors or these emerging types of technologies to solve transportation disadvantage? And what would it take for a traditional taxi cab company to have some leadership in this arena? Okay, so now I'll talk a little bit about the design of the pilot program and its implementation. And this focuses on the taxis, not on the van pools. This is the logic model that we developed for the program. Our main goal was to remove transportation barriers to employment in Madison, Wisconsin. With this overarching goal to enable low-income workers to access, current employment or even prospective employment opportunities with a shared ride taxi cab service. Now, the inputs to the program were mainly, we're seeking institutional commitment from employer partners. We were seeking funding for our operations and the evaluation of the program. We had input such as operations data from Union Cab, as well as human capital and sort of the activities of the research partners and community partners. Now, in terms of the outputs of the effort, in the short run and long run, we were looking toward things like establishing relationships with employers, literally providing the transportation to workers. We spent time marketing the initiative. We updated the initiative's model as we learned from our mistakes and learned about new opportunities to make it sustainable. In the long run, we were seeking to reduce the cost of commute trips for the participants. We were seeking to increase the utilization of Union Cab's existing capacity, in part by serving the second and third shift markets where Union Cab could use its fleet in an off-peak period. We were also seeking to serve many new riders. Now, in terms of outcomes, we were looking for, in the short run, improving job access, reducing barriers to jobs, improving worker attendance, improving job retention. But in the long run, we were thinking, if this could work, we could have a sustainable transportation option. We could establish a viable model for job transportation. We could have improved job outcomes for workers and improved worker health outcomes because of the link between individual and community health and income at a basic level, but also work in and of itself. These are some of the materials that we created to provide information to prospective riders or to prospective employers about how to sign up for a ride, how to schedule a commute, how to make the trip, and some frequently asked questions, such as, what is the program? What is the eligibility? How does one enroll? How much does it cost? How do they book their rides? How do they change or cancel a ride? How far can they go? Is there any sort of spatial limit? Is it available to any employee? And who could be contacted with questions? Now, in our actual operations of this, Union Cab there were two ways that people could get signed up. Really, we would give everybody Bill's phone number, the director of Union Cab, the business manager, and he would do the intake and then work with the dispatchers and the phone answerers and sort of the software that organizes all of the rides to input their data. Now, riders could also call the phone answerers directly and schedule rides and change rides. One could also use a mobile app. Most of our riders did not have that app or did not have a smartphone and were relatively difficult to reach. But it worked a lot like scheduling a taxi ride. In terms of the outcomes and reach, so we had our first rider on December 7th, 2018. And we have complete operations data available for the period December 2018 through May 2019. We have a lot of operations data for this period. We don't have operations data in June, July, and August because those data actually went missing. They were erased, they were hard to get, which was an error. So that is one finding off the bat. There are, in operations, sometimes our data systems will fail us. The trips, we gave over 2,100 trips. The mean distance of these trips was, 5.5, 6 miles. So this tells me that these were crosstown trips. Wisconsin, based on the size of our region. The duration of these trips was just over 12 minutes. The fare, the total fare on the meter was about $25. And this $5 copay as a portion of total fare overall was about just over 6% of the total fare. The percentage of rides where the rider did pay the full copay was only just, between 13 and 14%. And the percentage of rides that were actually no loads, where the rider doesn't show up for the ride, was about 12%. And I've heard that these figures are not that unusual for paratransit, but for Union Cab's general taxi business, a 12% no load is really high. They're accustomed to something more like 4%. And our shared rides were only 1.6% of all of the rides. So, in addition to having this high rate of no loads, we really did fail to reach the scale that we needed to have shared rides. Now, in terms of rider metrics, of the 81 riders who were participating in this 5-month period, the riders would make about 3.5 trips per week. And the program participation, total days from their first ride to their last ride, was 35 days. So this tells me that this service was not really serving a routine, sort of a routine trip, not exactly. This could be because underlying work patterns are not very routine in this population. It could be also that person has alternatives and they did not use this as their main mode. Some information about the demographic reach and the social demographic reach of the program. So our population who we reached through this was relatively young, female, African American, and reported sort of the lowest income levels on this scale. So mostly between ages of 18 and 29, about 60% of them were female, about 60% were self-identified as Black or African American, and just over half had income less than $10,000 per year. Now, in terms of their travel options, and this is, by the way, an N of 31 or around 31, depending on who was answering the questions, based on our rider intake surveys. The majority don't have any access to a vehicle. About 2/3 didn't have access to any vehicle at all, although there's some availability in a small proportion of this group. Most of the riders were employed. They were taking this to a job that they already had. Many were underemployed, though, and unemployed. We designed the survey to capture underemployment, which has a special definition. In terms of transportation to work, they were, in fact, using taxis, Ubers, and Lyfts as a complement to the Union Cab service. They would carpool, ride a bus, get rides from friends or relatives, or walk. Private vehicles had a very low share, as did bicycling. Some other characteristics that we learned about this population of riders. About half of them had stable work hours, but the rest had variable hours. Now that can have a significant effect on the ease with which one can get to work if this is a sort of a variable trip. 96% of them reported being hourly workers. Almost 60% reported having no benefits at work. Over 50% said that the transit cost, the cost of transit is prohibitive to using it as a main mode. 35% had Medicaid and 10% were uninsured. 16% had a medical condition that limited their travel. And almost 60% reported having missed a medical appointment because of lack of transportation. So these results from the survey shed a little light on the transportation disadvantage as this phenomenon that affects all aspects of a person's life, not only their travel to work, but also the difficulty of carrying out other basic things in life, such as access to healthcare and pharmacy. So some lessons that we learned. Now, in the process of implementing this program and trying to seek this this partnership with regional employers, regional employers were relatively easy for us to reach, and they were supportive to a point. The figure on the right is a kind of a program diagram. We would take program information out to employment agencies, specific employer sponsors within Union Cab to try to fish for these, recruit for riders, and say, they would be referred to Bill to do the intake. And the staffing agency turned out to be the main source of our riders. And this may have been why workers with more variable schedules were part of the program, because at the staffing agencies, they may have been, working in very, very entry-level jobs, the kind of work where somebody will call you at 4 o'clock in the morning to let you know whether you're on shift that morning, right? So it's very variable. Among the other employers we worked with, it was the smaller employers who signed up and who basically did provide an investment in the program, and their workers did have stable schedules. We did have some leads with some larger employers who would have more workers to include in the program, but at that point the cost maybe looked a little high to them, and they declined to move forward, though expressing a lot of support for the mission and so forth. So it was kind of hard to, we worked a lot with HR people, and sometimes we talked to CEOs, but it was relatively challenging for us to, talk to the person who had the authority to really sign the check. Working with the riders. Now, so the trip scheduling and service delivery, really a person just needed to call the phone operator, and they could call, within an hour or two before a ride and expect to be served. It worked a lot like a taxi company in that respect. And the Union Cab phone operator would sometimes have to determine whether the rider was making an eligible ride, because they did need to be rides to work. And this became sort of problematic. So in addition to not paying the copay and also having this high rate of no loads, after a month we started to receive requests for non-work rides, and sometimes from riders who were potential sort of maybe colleagues, or maybe just friends or acquaintances with an existing rider. And it really, through word of mouth, people learned about it, and the majority of the rides were legitimate rides, but it began to phone answerers began to have to do some screening, and this put burden on them. So we actually found in the implementation that within the taxi organization, phone answerers, though trained in the program, had a lot to say about what would make it work better, as did the drivers in their discretion about collecting, the copay. And our policy was, if they don't pay, just give them the ride anyway. But these became, relatively challenging. And now the figure also shows that information was put into a scheduling system. They have a software system called MTI that collects, a lot of data that they use for training and managing and overseeing their system. So the process, is feasible, But there were some controls that we needed to develop and policies we needed to develop to support our work. Now, in terms of sort of financial sustainability, we were using the grant to support this, both some of the CTEDD funding as well as the grant from Commute to Careers. But we had expected rider copays and some employer investments to also support it. And without these other sources, the grant funding dwindled after about 6 months. And also with some of this abuse, we did have to close certain rider accounts. But by that 6-month time, we had used up a lot of the funding. We continued the effort, and we still continue the effort to find employer match. And this is partly how we ended up partnering with JobRide, the Vanpool. And this was to increase our scale and increase our operational efficiencies with a partner that already serves a lot of employers in the region. So this is my transition to the second phase of our program, which we called mobilizeddane. So at some point in the development of these ideas and our pilot program of implementation, we began to participate in a competitive grant program that focused on Dane County, our county. And the challenge was to increase the net income of 10,000 households by 10% in 2 years. So by net income, we mean either increase their income or decrease the household costs. And we assembled a team to build on our experience in employment transportation. And this is how we began to work, not just with Union Cab, but also with JobRide, the Village of DeForest, our MPO, technology startup, right, to participate in the Stream Up Challenge, thinking that we think that we started with 81 riders, but it would be a significant challenge to reach 10,000. But we really think that based on the costs, it would be very feasible to increase the net income of 10,000 households by about $4,000. This Dream Up Challenge focused on the supporting the development of a middle class. And so people on the cusp of the a fragile middle class who would genuinely potentially experience benefit from having reliable transportation to work, and if they have a car, that car would be freed up maybe to another member of the household. So our first idea, our first challenge is, well, how are we going to achieve that scale? And the thought, can this taxi and Vanpool system work together? And maybe in a trunk or feeder system, or maybe in some other fancier system to serve like a regional need. Now, we were kind of currently just doing one-off rides for each other, right? The JobRide would call Union Cab to carry a rider. We thought, how could we take these services and also link them up with our city's transit system? So this is the problem of regional service integration to expand the reach. And the second idea was to create some organizational or institutional support to kind of create this foundation for that employer outreach. Employers are talking to their local economic development planners, community development planners, to say, we are having trouble recruiting and retaining employees. What can our cities do? What can our region do to help our labor market? TMAs were popular in the 1990s, and they indeed have been used to contract transportation operations, license information technology, do marketing, do outreach with employers, and use sort of business employer membership as sort of as a dues paying model. To maybe a transportation management association could be a nonprofit, a 501c3 or similar, collect these dues. They would be eligible for different grant programs, and they could be sort of a hub of information sharing and networking that could support regional rollout of transportation services. So we work with DeForest, a community in the outskirts of town with a growing job base, especially a job base that includes entry-level workers, to establish a TMA. And we did this through their new Community Development Authority, which they established in September 2020. And we have a seed grant of $20,000 that we raised through the Dream Up competition to use in that TMA to potentially support more rides, to leverage to get employer investment, you know, and to try to see, well, what could we do if we kind of invest in coordination at a local level, at a regional level. Our idea is to have TMAs that serve local interests, but have them in different communities in the region. We should note that although we have an MPO, we have actually 3 regional types of planning organizations. One that focuses on land use, one that focuses on economic development, and one that focuses on transportation. And we don't have a regional transportation authority that has the authority to raise revenue and to coordinate regional transit. So what we're doing here is encountering some of the structural limitations of regional governance and proposing a way that with regional governance, you know, a taxi and vanpool based employment transportation system would benefit from those types of regional supports. And then we would really also benefit from having information technology. Now, granted, Union Cab has sophisticated scheduling and dispatch software that it uses. It would be nice if that had some kind of a plugin, some kind of a way to get access to employee contact information, to origins and destinations, to ride times. If these could be collected at an employer level, could be shared securely, right, in a way that creates confidence with privacy of data and other such things. But we worked with the Madison Card. This is a technology startup company that was interested in creating a multimodal payment system, sort of an integrated fare card system. We thought, you know, something like this could be a point of entry to integrate multiple services, kind of a mobility as a service model, manage billing, and sort of plug in to a lot of the different systems that, you know, different regional operators and entities are creating to facilitate, you know, whether it's car share, bike share, commute ride matching, or mobility as a service. You know, there could be some information technology that helps us, kind of a public option information technology or an open source information technology that would help us integrate these services. So, you know, we were admittedly a grassroots sort of garage band initiative thinking about what would we do to innovate a traditional taxi cab company and serve this, this market for employment transportation. And we learned that giving rides with the Union Cab Commute to Careers program, it really wasn't sufficient on its own, and it needed system supports. And the specific supports that we envisioned needing are supportive institutions and regional planning activities, information technology, and so sort of the nuts and bolts of service integration. Now there's already a literature on service integration. I feel good that we can do that. But I feel like for the supportive institutions and information technology, we also sort of have to build those from scratch. We also discovered some blind spots. There are things that we really should have seen at the outset that we were not aware of. The first is the issue of variable work hours. Now we know that transportation traces people's everyday lives, that if you want to understand societies and economies, you can look to a person's mobility or a household's mobility. Well, we know that the nature of riders' work determined their schedules, and these variable hours in fact made it challenging for riders to be able to predict when they need a ride. And even though the taxi company can be responsive to that demand, it did create some administrative overhead to constantly change a person's ride time and to validate that the time was still indeed the correct time. So I think that that created some stress for people throughout the organization and some costs. You know, one of the things that we didn't do, but we really should have done from the outset, was to create a formally organized rider advocacy or a rider advisory committee, where riders would serve as paid volunteers to give us feedback and to advocate for this type of service and to kind of provide that perspective. Now, there's really no excuse for us not doing that. We are aware of what it takes to create, community-informed transportation services. And it wasn't part of our original model. And I think that our updated model would absolutely be based on this kind of direct input and a kind of a formalization of the role of the riders in the governance of the system. And then finally, very interesting to me, like, we had virtually no involvement in any formal planning, public engagement, or any other sort of off-the-shelf transportation planning system or transportation planning process. Now, while we worked with local governments, the regional metropolitan planning organization, we participated in specialized, our specialized transportation committee at the county level. We ourselves, we did not create a planning process for this. We did not seek public engagement or public input on our own sort of what we kind of, I think, considered private activities. And I feel that that is something that we would do differently, and that this kind of work does need to be based in that sort of public transportation mindset. And there were some exceptions, like I mentioned. We did participate in the Specialized Transportation Committee, and Union Cab does participate in sort of political lobbying activities. They're a registered lobby, Bill Carter is a registered lobbyist, and sort of participates in policy through those mechanisms. But this is an area where, that wasn't part of our design. We're thinking almost entirely about operations. But in the end, I think we would do that differently. And some lessons for future regional transportation. This effort has brought some clarity about the limits to simple collaboration between workforce development initiatives and transportation initiatives. And really, we borrow this title from an article that I really appreciate. It's called Collaboration is Not Enough. That we had a fair amount of collaboration and goodwill. We had service integration and a lot of movement that was very positive. But without a stronger sort of policy support, that this becomes an area of transportation policy and service that is kind of, you can't just do everything through voluntary activities and through sort of ad hoc collaboration. There's a reason why we create policies and plans to support complex transportation systems. So I feel that this also demonstrates, then kind of highlights some of the gaps in existing transportation policy and service delivery in the specialized transportation market. There are a variety of different users in this market, and there are a variety of different forms. There's veterans transportation, non-emergency medical transportation, paratransit of different types for different types of users with different eligibilities. Different types of transportation services for seniors that are often tied to senior centers and other county or state-based organizations that serve seniors. So there is a lot of interest in the expanding and supporting mobility for non-drivers. And there's really a demand for this, and it seems that it is a solvable problem if one were to focus on the future, focus on developing the institutions and the technologies, information technologies, maybe vehicle technologies, to envision a future model where we can coordinate the existing services, find efficiencies, and provide high quality transportation. This is potentially a moment to reconfigure some of our existing transportation services. Now, I think that this is my last slide. I'm at 40 minutes or so this should not be too unbearable in terms of time. I hope. I appreciate the opportunity to share the work. I obviously appreciate all of the support from CTEDD, the excellent professionalism and relationships in this organization and colleagues there. It's been a fantastic experience to work on the Commute to Careers project with these excellent partners. And we do move forward in this finding our way, and welcome any feedback that you may have or questions about the program.